regard to the edema or the swelling, that essentially acts as a protective mechanism for your actual ankle. You could think of it as your body's internal brace system. The whole point of a brace, when you put a brace on, is to immobilize the joint. Hey everyone, thanks for tuning in. Steven here with Team Euphoric, and today I'm going to be teaching you how to be your own therapist and treat your own ankle sprain. Over the last week, I've had two different people reach out to me regarding ankle sprains. One was an old friend from elementary school, and the second, I was recently in the Discord server app for John Glad Van Dam, aka Obese to Beast, and one of the users in the Discord had also inquired about an ankle sprain and how exactly to rehabilitate it. So I thought, why not make a video on it since this is a pretty common injury? Now, with regard to the actual ankle sprain, I'm going to get into different things. I want to discuss the actual acute phase, what you can experience in terms of symptomology, and then I would like to get into some observations that you can make, and then finally I'm going to get into the actual rehabilitation process. With regard to the actual symptoms that you may experience, this is going to differ depending on the actual grade of the sprain. There are 3 different grades, 1, 2, and 3. Each single one is going to be more severe than the last. In terms of the actual symptoms, with regard to a grade 1 sprain, typically what you're going to notice with this one is there's going to be a minor stretch to the actual ligament, and there's going to be some mild pain if you end up stressing the ligament that is affected. Another thing is you may experience that there's going to be some minimal local edema, but the joint itself is still going to be stable and you can still perform regular activity. I just want to make one quick note. If you are somebody who is not a manual therapist, if you are somebody who just sprained your ankle and you are watching this video, just know that whenever I say the word edema, that is the medical term for swelling. So whenever you hear me say edema, just think swelling in your head. Now I want to get on to a grade 2 sprain. With a grade 2 sprain, there's going to be tearing of some or many of the fibers of the actual ligament that is affected, and there's going to be moderate pain at rest and during activity that stresses any of the ligaments that are affected. Another thing with a grade 2 sprain is you will notice some moderate local edema at the actual site, and there can be some heat and a burning sensation. There's also going to be possible joint instability, and there can be pain during the actual activity. That's it for grade 2. With regard to a grade 3 sprain, this is a complete rupture of the actual ligament that is affected, or there could be an avulsion fracture. Also, you can expect to see some noticeable local edema in the actual affected ligament, and there's also going to be noticeable amount of actual heat, and aside from heat, you can also expect some burning sensation and possibly a hematoma. Another thing with a grade 3 sprain is that the joint itself is going to be very, very unstable, and aside from being unstable, the patient is not going to be able to actually put any type of weight on the actual limb itself because it is going to be quite painful. That is it for the 3 different grades. Now, I want to get into, regardless of what grade, you can expect these symptoms with regard to all 3 of the different grades. Typically, you are going to notice some type of bruising, and there's going to be some type of discoloration. In terms of the discoloration, you can expect to see red, black, and blue over the area that is affected. And then also, there's going to be a lot of decreased range of motion due to the edema that is present. And once again, there's going to be pain at the actual site. Now, with regard to the edema or the swelling, that essentially acts as a protective mechanism for your actual ankle. You can think of it as your body's internal brace system. The whole point of a brace, when you put a brace on, is to immobilize the joint. And whenever your ankle or any sprain in general ends up swelling up, that swelling is meant to immobilize the joint, because if you end up developing a sprain and you are able to mobilize your joint at the ankle, what's going to happen is that mobilization, you could possibly cause further damage. So the whole point of swelling is to immobilize the joint and essentially act as a brace system. That's pretty much it in terms of the symptoms. Next, I want to get into some actual observations. If you are a manual therapist, or even if you are a patient yourself, and these are some things that you can notice with regard to a sprain. If you suspect a sprain, number 1, if a patient comes in with an antalgic gait pattern, that can indicate a possible sprain. An antalgic gait pattern, for those of you who do not know, is essentially a painful type of gait pattern. So if you see somebody coming in with a limp, that could indicate some type of sprain. With regard to an antalgic gait, this is only going to apply if you have a sprain to an actual weight-bearing ligament. You're not going to end up walking in with a limp if you end up spraining your wrist, because your wrist is not a weight-bearing joint. But anyway, back to the actual observations that you can experience. With regard to the actual grades, the more severe the grade, the worse the actual gait is going to be. With a grade 1, you could expect a little bit of limping, but the actual patient themselves will still be able to bear weight on their actual limb. With regard to a grade 2, you may see a patient come to you with what is referred to as a foot flat. A foot flat during the actual gait pattern, there are different phases to the gait. We essentially have a heel strike, then we have a foot flat, we have a toes, and then we have a toe off. If somebody comes to you with a grade 2 sprain, what a foot flat is, it is essentially they are not doing the heel strike and they are not doing the toe off. So instead of having a normal gait pattern where they end up going heel strike, foot, toe, and then toe off, what they're going to do is they are going to place all of their weight with a flat foot. So they are just going to end up kind of walking in like this, and their foot is just going to constantly be going flat on the ground as opposed to kind of like an arch where it goes heel, foot, toes, heel, foot, toes. Instead, it's just foot all the way down every single time. That is for grade 2. And then with regard to a grade 3 sprain, this one over here, the patient is going to be unable to put any type of weight on their actual affected limb because it is completely ruptured. So they're not going to be able to put any type of weight on it. Now, the next thing in terms of observations, if you are a manual therapist and you are doing any type of palpation, so actually touching the affected area to see what exactly is going on, you can expect to see heat present over the actual affected site. And aside from that, you can also expect tenderness to be present at the actual affected ligament. With regard to the tenderness, this one right over here, the texture is going to be very, very firm in the acute stage. And then as you get to the early subacute, late subacute, and then the chronic stages, then it is going to become a little bit more pliable and a little bit more soft. But if you notice that the actual edema itself is very, very firm, that would be a sign that they are in the acute phase, so the first 48 to 72 hours. And now that we got all that out of the way, we know what the symptoms are, we know what to observe when you're looking at them. The next thing, what are the actual exercises that we can do in terms of the actual rehabilitation? Well, when it comes to rehabilitating an ankle sprain or any sprain in general, there are essentially 4 different phases that you want to go through in order. It is going to be mobility, stability, strength, and then power. With regard to mobility, this is all we're going to be doing in the acute phase. So in the first 48 to 72 hours, what we want to do is we can't actually mobilize the actual ankle itself because, again, the swelling is acting as a brace system. It does not want to move your ankle. It wants to be immobilized. So what we can do so that we don't end up developing any type of adhesions or restrictions in the ankle is we would want to mobilize the proximal and the distal joints. At the ankle, the distal joint is going to be the toes. The proximal joint is going to be the actual knee. So in terms of what we would actually do, some things that we could do in the acute phase would be we would want to do some toe flexor and toe extensor stretches, and also we can actually stretch the quadricep muscle. With regard to the toe stretches, what you can do for this one over here is you can put your foot up, you can extend your toes, so point your toes toward your head. If you want to incorporate a little bit of PNF, you can also flex your toes down to the ground, so you're going to apply a pressure and then exhale, relax, and stretch it a little bit more. I believe I actually made a video a few months back on a PNF stretch for the actual ankle. If I did make a video, I'll include a link right up over here so you can watch that. If I didn't, then tough luck. You guys can just pay attention to what exactly I'm saying. But that is the toe flexor stretch. So when we are stretching the toe flexors, we bring the toes into extension. Next, we want to stretch the toe extensors. To stretch the extensors, we are going to place the toes into flexion. So our toes, we are going to point them down toward the floor. There's a couple of ways that we can do this one. One is just the way I'm doing it right now, where you point your toes toward the floor, you lift your toes up to apply an isometric contraction, and then you exhale and you get further into the stretch. The second way, if you are able to, if it's not too painful, this would be a little bit better more for a grade 1 or 2. For a grade 3, this one is a little iffy, but what you can do is just stand on one leg and then you would gently stretch out the toes of the actual affected limb. This one over here, if you have good balance or you have something to hold on to, you could try this, but the one where you're sitting down is going to be just as effective. You could try different ones depending on your stability and all that different type of stuff. See which one is best for you, but those are a few things that we could do for the toe flexors and toe extensors. Next, we would flex the actual quadricep muscle. For the quadricep, what you could do for this one is either sit down or stand up, and this would just be your basic quadricep stretch. I'm not going to get into anything too crazy, but this is essentially what you're doing for the quadricep muscle. You're taking your foot, you're bringing it toward your butt. Another way that you could do this, you can do it on the floor as well. If you want to do it on the floor, this one would be more reminiscent of the actual myofascial stretch for the quadricep muscle, but you're lying down on your stomach, and then you would essentially just take your foot, pull it straight across. Depending on the fibers of the quadricep that you are stretching, that would dictate how exactly you position the foot. If you want to stretch the vastus intermedius, that is the quadricep muscle that runs straight down the middle, you would just go straight up toward your butt. If you wanted to stretch the vastus medialis is the inner thigh muscle. That's the quadricep on the inside, the teardrop muscle. For that one, instead of going straight, you would bring your foot out to the side to get a little bit more stretch on the vastus medialis. Then if you wanted to stretch the vastus lateralis is the most lateral of the quadricep muscles. So because it's to the outside, we would want to pull our foot toward the opposite butt. And that would be how we would end up stretching the different areas of the actual quadricep muscle. Next, you could also do some stretching of the actual hamstring muscle. For the hamstrings, there are a few different ways that we could do this one. Same thing with regard to the actual quadricep muscle. Depending on which hamstring muscle you would want to stretch, it would dictate the actual foot position, because we have 3 hamstring muscles. We have a semimembranosus, semitendinosus, and then a biceps femoris. With regard to those 3 muscles, the semimembranosus is the most medial, so closest to the inside. The semitendinosus is the one right in the middle. And then the biceps femoris, this one over here, it has 2 different heads. There's a long head and a short head, and they are the lateral most hamstring muscle, so it goes to the outside. If you wanted to stretch this one and you wanted to do the myofascial stretching for the hamstring, what you could do is you would sit down on the floor with your foot straight. You would hug one foot over you, so just keep it right over here. You could take your arms into external rotation, and then what you would do is go into pseudo inversion. So you're going to dorsiflex, invert, internally rotate. Straight down the middle, this would be for the semitendinosus. If you wanted to do the semimembranosus, you bring your foot to the outside. If you wanted to do the biceps femoris, then you would bring your foot to the inside, and you can even rotate a little bit to have a relative internal rotation. That is it for the actual stretches themselves. That would be in the acute phase. Next, we would actually want to start working on the ankle itself. This, we can start doing it in the early subacute, possibly even the late subacute phase. But with regard to this phase right over here, this is when we want to start working on active range of motion of the actual ankle. With regard to the actual active range of motion, that is why I have all these lovely tools right over here. The first one that I want to show you is a wobble board. This is a wobble board. There is a little kind of wobbly thing on the bottom. I don't know how exactly to explain it, but this is going to provide balance if you were actually standing on it. This is a great tool though if you're not going to be using it for balance, just to use it as an active range of motion assister. What you could do, you would put it on the floor, and I don't think you could actually see it on camera, so what I'm going to do is move back a little bit so you guys can see it. With regard to the ankle, there are 4 or 5 actions technically that we are going to be working on. Plantar flexion, so bringing your toes, pointing your ankle toward the floor. Dorsiflexion, pointing toward your head. Inversion, the sole of your foot toward the inside. Eversion, sole of your foot toward the outside. And then we are going to combine all 4 of those range of motions and do circumduction. With regard to the actual first one, plantar flexion and dorsiflexion, you could get your foot on the wobble board, and you want to keep your knee nice and straight. What you are going to do is point your toes down to the ground until the wobble board touches the floor, or as far as you can go without experiencing any type of pain. And then you are going to go into dorsiflexion by moving your heel toward the ground and having the back of the wobble board touch the floor. So you're just going to go plantar flexion, dorsiflexion, plantar flexion, dorsiflexion. Next, we would want to do inversion and eversion. With regard to inversion, again, the sole of your foot is pointing toward the inside. So we are essentially collapsing the lateral arch of the foot. So we want to point the sole in. So we go into inversion. And then for eversion, you can think of that as collapsing the medial arch. So you're flattening out your foot. So what we want to do is go into eversion by pointing the sole outside. So inversion, eversion, inversion, eversion. And then finally, we would combine all of those movements and end up doing circumduction. With circumduction, you put the wobble board on the floor, make sure your knee is straight, and then we would draw a circle. So try and get the entire edge of the wobble board to draw a nice circle along the actual floor. And then you could also reverse the direction. So you could go clockwise, you could go counterclockwise, but that would be it for the actual active range of motion. We have the wobble board, plantar flexion, dorsiflexion, inversion, eversion, and then circumduction. Next, we move into phase 2. Phase 2, now we are working on stability. With regard to stability, depending on the actual ligament that is affected, that is going to dictate the exercises that we do. But with regard to stability, the number one thing that we would want to work on is proprioception of the actual ankle ligaments. With regard to the proprioception exercises, they are going to differ depending on which ligaments are affected. I'm not going to get into every single one of the proprioception exercises because that would take forever. Instead, I'm going to provide you with 2 exercises for the 2 most commonly sprained ligaments in the actual ankle. Number 1 is going to be the anterior talofibular ligament, and number 2 is going to be the calcaneofibular ligament. With regard to the anterior talofibular ligament, this one right over here, it is going to be in a single leg stance. So we are going to be balancing on one leg. What we want to do is get into retroversion of the pelvis, so a posterior pelvic tilt. We are going to flatten our spine, and then we are going to extend our knees, so straighten out the leg. So we have retroversion of the pelvis. We are going to straighten out the knee. Next, we want to externally rotate the cuboid. Let's say this is my foot. We have the navicular, it's going to be on the medial aspect of the arch, and then the cuboid is on the lateral aspect. So the cuboid right over here, we want to externally rotate it. With regard to this right over here, you want to have the intention of actually externally rotating your foot, but your foot is going to stay planted. So you're not actually moving your foot. It is going to be a stationary foot, but you want to have the intention of externally rotating it. So posterior pelvic tilt or retroversion, straighten out the knee, external rotation of the cuboid. Next, we are going to internally rotate the fibula. The fibula is one of the shin bones. We have the tibia, which is the actual big shin bone, and then the fibula is the one that is more lateral to the outside. It is a much smaller bone. So the fibula, we want to internally rotate that bone over there. We want to have the intention of internally rotating the fibula. Next, we are going to place a varus force at the actual ankle. So think of it as making a big arch with your actual foot. You want to raise the arch, so you're pushing your ankle toward the outside to get that varus force. Once we've done that, we want to plant the 5 metatarsal, the heads of the metatarsals, down onto the floor. So the bones of our 5 toes, we are pushing that down, and then we are raising our toes up to the sky. So real quick, we are going to go into retroversion of the pelvis. We're going to extend our knee, so we're going to straighten out the knee nice and lock it out. We are going to externally rotate the cuboid. We are going to internally rotate the fibula, and then we are going to end up going into a varus force by lifting up the medial arch. We are going to plant the 5 metatarsals down to the floor and raise the toes. Once we've done all that, put your hands out to the side, raise your leg, and you are simply going to balance while maintaining all of those different actions. With regard to this one over here, there are different factors of progression that you can do to make this a little bit more difficult. Start out with your hands just by your side like this, and then eventually what you could do, bring your hands up to horizontal, that's going to make it more difficult, up to the sky, that's going to make it even more difficult, and then you could close your eyes. And those are different ways that you could progress the actual proprioception exercise. And now next we have the calcaneofibular ligament. With regard to this one right over here, pretty much a lot of the stuff is going to be very, very similar. We're going to go into retroversion of the pelvis, we're going to extend the knee, so lock it out. We are then going to push the navicular down to the floor. If you remember, the navicular is on the medial arch. So the medial arch, think of collapsing the arch on your actual foot, so you're going to end up getting a flat foot. Once we've done that, then the next step is you want to push the cuboid down to the floor as well. So you are pushing the medial arch and the lateral arch both down toward the foot. So if this is your foot, cuboid, navicular down, cuboid down, so you are flattening out both arches of your foot. Once we've done that, then we are going to be doing a valgus force at the ankle. Valgus means a lateral force. So we want to flatten out the arch, the medial arch of the actual foot, and then same thing with regard to the last part of the actual steps. We are going to push the 5 heads of the metatarsals down to the floor, and we are going to, for this one, our toes are going to remain flat on the floor. We're not raising our toes. But again, retroversion of the pelvis, extension of the knee, so we're locking out the knee. We are going to push the navicular down, push the cuboid down, so we are collapsing the medial arch, collapsing the lateral arch, and then we are applying a valgus force by flattening out the arch, pushing the 5 heads of the metatarsal down to the floor, and keeping the toes on the floor. Same thing with this one, different factors of progression. This is going to be the easiest, this is going to be a little bit more difficult, a little bit more, and then you could close your eyes to make it even more challenging. Those are the very specific proprioception exercises. These are not 100% correct in how exactly to perform the proprioception exercises, but there are a lot of steps involved. I didn't want to go all into the weeds with this one right over here because it can get pretty complicated, and if you don't have somebody actually palpating you and cueing you with all these different movements, to do it 100% is going to be very, very difficult. But as long as you can maintain these specific patterns when you are doing the actual proprioception exercises, those are going to be good enough for those 2 particular ligaments. Now, with regard to proprioception, if you're not really sure which ligament you actually ended up spraining, then you could just do some general proprioception exercises by doing some single leg balance stuff. So if you're not familiar with the ligament that you actually ended up spraining, then just do some basic single leg stance. Just stand on one foot. Same thing, you could do the different factors of progression. If that feels a little bit easily, then what we could do is progress it one step further. So if you're able to balance on one leg, then next we can start busting out some of our fun little toys over here. The first toy is going to be the Bosu ball. With regard to the Bosu ball, dome side up, this is going to be the first progression. So we are just going to stand and balance on one leg. If you're able to do that, once you feel comfortable, then what you are going to do is flip it up. You're going to have the dome side down. You are going to plant your foot, get nice and centered on the actual Bosu, and then you are going to balance on the Bosu. If you are able to do that, then the next step is going to be the actual wobble board. For the wobble board, pretty much the same thing as with the Bosu. You're going to stand right on the center of the actual wobble board itself, and then you are just going to balance on the wobble board. And then if you are able to do that, you can take a balance cushion, put it on the floor, same thing. Stand on it and just balance on the balance cushion. If you don't have any of this equipment available, what you can do, just do it single leg on the floor, and then if you want to make it a little bit more challenging, anything that you are standing on that is not a flat surface is going to make it a lot more difficult. So what you can do is just get some towels, some pillows, some blankets, put it on the floor, something that provides a little bit of cushion that is going to make your ankle work. Once we've done all that, next thing that we want to do is phase 3, and phase 3 is going to be the strengthening phase. For the strengthening phase, there are 3 exercises. We are going to be doing 3 versions of a different calf raise. We have your standard calf raise where you go 2 legs up, 1 down. Then we have a 2 legs up, 1 foot down, and then 1 single leg calf raise. I'm going to show you exactly how this is going to work. So phase 1, first of all, what you would want to prop your heels up a little bit. And right now I'd have nothing underneath my actual toes, but you would put something like this. So you would want your toes to be elevated, that way you can get a nice stretch on the actual gastrocnemius muscle, which is your actual calf muscle. So with regard to this one right over here, this first one right over here, you're going to be doing 2 feet at the same time. So what you want to do is up on both feet, down on both feet, up on both feet, down on both feet. Once that feels comfortable and you feel like you have good strength in your ankle, then we can progress it to 2 up, 1 down. So you're going to do a calf raise up on both feet, and then the ankle that is affected, that one over there, that is going to remain on the floor, and the unaffected ankle, you are going to lift it as you lower down to the ground. So up with both, and then you're lowering on the affected ankle. Up with both, lowering on the affected. Once you are able to do that, then you could just do a single leg calf raise. So those are the 3 different strengthening phases with regard to the calf. We have 2 up, 2 down, then we have 2 up, 1 down, and then finally we have 1 up, 1 down. Now, next is going to be the final phase of the actual rehabilitation process, and this is going to be the power phase. With regard to power, this one right over here, essentially some things that you could do are different versions of hopping exercises. So the easiest is just going to be some front to back hopping. You can also do some lateral hopping, so side to side. Once you've done the lateral hopping, then we can do a diagonal. So we could go forward and across, backward and across. So you're just going in different directions, and that is going to be the different phases of the power. Another thing with regard to power is if you have something like a rebounder, which is essentially a trampoline, you could also do some jumping exercises on the actual rebounder, but that's pretty much it in terms of ankle rehabilitation and what you can do if you have an actual ankle sprain. If you guys enjoyed the video, then be sure to smash that like button so I know to make more of these types of videos in the future. And if you're either new to the channel or haven't subscribed yet, be sure to subscribe to the channel and hit the notification bell, as I will be uploading new videos every single day. That's it for today's video. Thanks for tuning in, and I will see you again tomorrow.